PPO plans are absolutely working on commoditizing dentistry. In their view, a crown is a crown is a crown. A filling is a filling is a filling. A new patient appointment is the same regardless of where you go. That's their view. How do I know that's the case, Naren? Because they pay the same thing everywhere.
Yes.
With no regard to whether there's any differences.
Yeah. You could use technology. They don't care.
They literally don't care. They don't care. It's this is how much we're going to pay you. And they are commoditizing dentistry. And I believe that if you continue to stay participating with the PPO plans, it is a flat out race to the bottom. It's a race to the bottom. All I have to do is recount to you the fact that PPO plans are cutting your fees. They're reducing your fees. Even in the face of double-digit inflation, in the face of rising expenses, they're lowering the fees they're paying you for the service rather than increasing the fees. There are PPO plans in the country that haven't had a fee increase since 2009. I know of another one that hasn't had a fee increase since 2007. Naren, can you imagine working in any business where you wouldn't have had a raise since 2007?
Yeah, I mean, it's really hard, right? Even like think of the recent inflation recycle, and you go to a restaurant, they're charging you 30% more at least. I mean, every single restaurant that I go to today many of them are even 40-50% more than what it used to be pre-pandemic. And that's because their costs have gone up. Their labor costs are up. Their ingredient costs are up. Everything is up. So they have to pass it on. Now, if you're a dentist, especially a PPO dentist, you can't do it. You are stuck by the fee.
Well, you can. You just have to take a big haircut in your income.
Yes. Yes.
You're just getting a big haircut on this.
Yeah, because you're charging the same amount to your patients, but your expenses are up. So you're getting a big haircut.
Expenses are up. Your income's down because they're paying you less.
Right.
And if I get my crystal ball out, Naren, I don't actually have one, but if I had one, if I had a crystal ball, I see us very much going down the path in dentistry in the way dentistry is in England. I've had the privilege of traveling extensively in the United Kingdom, lecturing, throughout the UK. And if we look at dentistry in England, there's two styles of practice in England. There is the largest group, 2/3 of the practices are NHS, National Health Service practices. Who sets the fees in those NHS practices, Naren?
Definitely not the dentist, probably the government, right?
The government sets fee.
Yeah.
They set the fee.
Right. And it's the same fee pretty much.
It's the same fee.
Yeah.
And 2/3 of the practices are NHS. I would say the equivalent to those would be PPO practices. It would be their version of PPO.
Right.
Where the fees are set by another entity. They're not set by the dentist.
Right. Here it's the insurance company, there it's the government. But
Right.
Either ways, you have no control.
Now, 1/3 of the practices in England are private practice dentists. And from what I'm told by my English friends, and I have a wonderful cross-section of English friends, and many are regular working class folks. And what they tell me is that anybody that can go to a private practice will go there. Anybody that can, if they can figure out how to put together the resources to go to private practice, they will.
Yeah.
Because they want to avoid receiving care in the NHS practices.
Yeah, it's like the lowest common denominator care or excellent care. So you choose.
Yeah, it's quality care or lowest common denominator.
Yeah.
And I see the same thing happening here.
Actually, Gary, even in Canada, I think exactly the same thing is going to happen.
True.
It's just moving in that direction.
You're moving in that direction as well. Well, and of course you're influenced by England. You have historic influence,
Yes.
and you're being influenced that way as well. Sure, but I think that's what's going to happen here. If I get my crystal ball out, there will be practices that say, "Well, I don't have any choice, and woe is me. I can't do anything about it. I don't like these PPO plans, but I don't have a choice. So I'm going to just get in line, and I'm going to be a pharmacist that now goes to work for Walgreens."
Right.
You'll be the dental version of the pharmacist, or the independent optometrist that goes to work for the optometrist in a box.
Can I share a personal story, Gary? And it might make sense. So I have my cousin who lives in the UK. He used to own those gas stations, but the way it works in the UK, at least the one that he was associated with, is it's almost not even like a franchise, but pretty much you're a licensee. So they give you the benefit to use their logo and do it. And what they do is every single year they squeeze you. They let this fee, that fee, this fee, that fee. So his income was, let's say, 100,000, pounds 3 years ago. Little by little goes to 80 and 70 and 60. And the reason is they have all the control. So you don't like it, take a hike. I'll find somebody else. It's kind of sad, but it's just, that's what happens when you have a single entity calling the shots.
Right. Well, you're absolutely right, Naren. And when you have someone setting your fees other than yourself,
right?
You're the only one that should set your fees, in my opinion, because you know what your cost of doing business is, and you set your fees accordingly. When you let a third party set your fees, by the way, if that third party is only interested in commoditizing dentistry, then they're going to set those fees as low as they can get away with. And that's what they do.